actual quotes that over the course of a few months, different people said to one of my colleagues. So this can reflect that people sometimes are in difficult places, and that will mean it's hard for them to get the energy and enthusiasm to keep going. So as people who are supporting them, just giving them every opportunity to be as active as they want to be, and respecting that on different days they might feel they want to do different things. But if we can help people to remain more active, then they will have less boredom, they have improved social interaction, improved well-being and a quality of life just because they're engaging more actively in life, and the increased potential for functional independence. So those are the sort of social emotional benefits, but also, and as this lady said, and this was a lady who was very, very disabled, but actually she could take part in rolling over in bed. She so much liked to have that opportunity to be involved as much as she could be, even if it was very limited, rather than just people doing things to her. Within the training that we're suggesting, it's a very practically based training where there's an assessment of competences as we go along. So, and again, it's that gaining these care skills through actually doing and practicing and getting a confidence in them. So this is obviously just a half-hour snippet, whereas the full package that we're providing is maybe 7.5. It can be altered and made bespoke to whatever the person wants, but with those very practical opportunities to learn these skills. But those health benefits for the lungs, for the heart, the circulation and the skin, muscles, keeping that strength of muscles up, because the biggest spiral is lack of activity leading to reduced strength, leading to lack of activity. So if through activity we can just keep that muscular strength going, then we've got that chance of keeping people active so much longer. So sitting to standing. So I want to actually ask you to do the exercise, but what we have to do is, when we're helping people, provide that level of assistance, no more or less than is needed at all times. So if we always come in without thinking, we may well be giving people too much help. And actually that's not the way they're going to progress or maintain their abilities the best way they can do. So it's getting that level of assistance just at the right level so people can do just what they can for themselves. So if we're thinking about that initial stage of moving from sitting to standing, there's some key elements of that. Always a good starting position for good movement, so if people can sit well. They may well need to come to the front of the chair, so if so their feet are in a good position. They certainly need to have their feet under the knees or a little bit behind the knees so they get good purchase. And if they can, again, generally speaking, it's appropriate for people to assist, perhaps by pushing upon the arms of the chair. It's very individual, that's a general rule of thumb. And then people who have been cared for by healthcare assistants will know what's on their care plan and follow that advice as it's set forwards. And the idea of coming out of a chair, sometimes people think it's coming up, but actually it's about coming forwards and up. So it's taking weight from your pelvis over your feet, and yet I think without that sort of training you may think it's just about getting people up, but that's when it becomes a very big load for the person who's assisting them as well, if you're trying to lift people up rather than assisting people to bring the weight onto the feet and get up in that way. So walking, it's we have to keep walking to be able to keep our ability to walk, but it's that quality of walking. Not walking in such a poor way that we're losing the ability, getting into bad habits, keeping active. Falls is a really important health and social care feature on the agenda at the moment. It's a leading cause of mortality in the 75% age group, and 25% of older people who fall in care homes suffer serious injury. And 40% of hospital admissions for the 65s were a consequence of falling. It's a really important problem, so it's important for people who are assisting people to know how to help them. So, we come back to this providing the right amount of assistance for people, no more than they need, but being ready to provide more when it's necessary. So just thinking, planning, do the person need one person or do they need two? Maybe they need one to support them and somebody else as a standby. Maybe they just need a light touch, or perhaps even just very close supervision. So it's a matter of gauging exactly the right level of assistance that person needs and being prepared to change it from day to day. If somebody's a good day, or maybe when they first start walking, they need a little bit more help, and then as they get help, we can just reduce that help a little bit. What walking aids do they need? Where are they walking? Keep those muscles very strong and active. So where walking, if somebody's unsure and unsafe on their feet, then walking by a wall will enable them to walk much more easily than walking across a big open space. Then knowing that they're only going to be asked to do a small distance, or that they will only be asked to do whatever they want to do, will give them that confidence to have a go. Even if it's only a couple of steps today, maybe the next day they'll be happy to walk that bit further. And providing skillful care is knowing just how close you have to stay to somebody, because if you're even, a foot or so away, that wobble becomes a lead, and then the strongest person won't be able to grab them. Whereas if you're very close and somebody's just wobbling a tiny bit, you can easily stabilise them and get them back to that middle position. Again, these sorts of things are what we would in a full course would be able to do practically, which would be really helpful, just giving people the feel for it and the skills in doing that. So we're going to think carefully when we're assisting somebody about preparing the area, but work together in teamwork with the person that you're working with. The speed of activity. It's very easy to work at our speed, to walk or to help somebody move at our speed, but we should be gearing it up to walk at the speed of the person we're working with. And again, that appropriate level of demand. Not being frightened to give a bit of assistance, but being careful not to give too much assistance. So really getting the people to do what they can for them.